So this is our first time ever having brunch together and talking all about the beauty stuff. I invited all of you because you guys are like the beauty mafia of Southern Connecticut. And before we start, let's go around and introduce ourselves. I'm Josie, and I just love beauty stuff. I don't work in the beauty industry except on the periphery in marketing, and I just love learning about all this stuff, and I really appreciate you guys coming. Do you want to start? Lisa, why don't you introduce yourself?
Sure. Lisa Topham from Split Rock Aesthetic. And that's who I am. Lisa Topham at Split Rock.
Lisa,
Nice
what do you
see
do? Tell us about what your beauty expertise is in.
My beauty expertise is everything non-surgical. So my medical director is a facial plastic surgeon, and I do everything that you would need to do before seeing a surgeon, and then again after.
So you are a nurse injector.
I'm a nurse injector. Yep.
How long have you been doing this?
Way too long. It's going to be 40 years.
Shut up.
Shut
and
the
she
front
doesn't
door.
look a day over 20. It's wild. We're going to come back to you, but before we get into the nitty gritty of what you're going to talk about, I want you to introduce yourself.
Okay.
Kathleen, please.
I'm Kathleen Jowdy, and I own Get Glowing. I've been in Ridgefield for about 15 years, but I've been in the aesthetic industry for, 32 years.
Oh my gosh, you're on my tail strings.
Yep, 32 years.
And how did you start in aesthetics?
Well, I've always been like into beauty and stuff like that, but I was working at a beauty counter when I was younger, and the founder of the Day Spa concept, who's Noelle DiCaprio, she owns Noelle Day Spa in Stamford. She came up to my counter and she liked me, and she asked me if I would come to her space and start doing makeup and lessons for women who have cancer.
Oh, that's awesome way that you entered into
So that, so you know, they're losing their hair and their eyebrows and their lashes. So that's how I started. And then she sent me to training with Decleur Paris. They had an academy in Greenwich at the time.
That is so awesome. Yeah. And now you're just a lash and eyebrow expert of Southern Connecticut.
Mm-hmm. Well, my biggest revenue is still airbrush tanning.
Really?
Yeah.
We have to talk about that at some
Yeah,
point.
I really push that especially for the young girls who, think they're like cancer free or nothing can happen to them, So
this is so interesting. So working with cancer patients really informed all of the modalities that you use.
Yeah, a lot of it. Yeah. I think the sun is worse for aging than drinking or smoking.
And so she said I could drink and smoke. That's what I heard. That's all I heard.
I know, you can.
And Jillian, can you please introduce yourself?
Mm-hmm. I'm Jillian Curlee, and I am the holistic wellness provider for SveleteSolutions. I've been in the wellness industry for 20 years, since right out of college. And I focus really on how your physical energy and your metaphysical energy combine and present in your body. So whether it's you have an aesthetic issue going on or a physical limitation or, I don't know how to phrase.
Or your soul's disturbed.
Or your soul is disturbed, yes.
So I need to work
I'm
a
your
lot
girl.
with
Yeah.
Jillian. Jillian, tell me about SveleteSolutions. What's SveleteSolutions?
SveleteSolutions is a medical weight loss and wellness clinic. And we are working to bring on hormone optimization to just create a more well-rounded symbiotic environment in the female body. And hopefully bring some answers to a lot of issues that women are facing.
So you guys do hormones, you do weight loss, anything else? Any other services that we should know about?
We do offer the weight loss, the hormones, Reiki, personal training, meal plans, any type of lifestyle coaching that you might be in search of.
Oh, so it's full service.
Full service.
Full service. Mm-hmm. Okay, so I today brought you guys together because I really want to talk about under eyes. I know that for me, I didn't even think about anything in aesthetics until my under eyes started giving me some trouble because I am very vain. And when I started seeing some crinkles, that's how I met Lisa. I called Lisa and I said, what are these hollows about? What is this wrinkles about? And Lisa told me that our under eyes are the first place we see signs of aging. And that made me real sad, but then I was really happy to meet Lisa. So Lisa.
Yes.
Tell me some medical, non-surgical options we have to rejuvenate the under eye. Because I know, like, when I first met you, I felt like I had huge, I didn't feel it was authentic. I had huge hollows under my eyes and a little dark circles also, which I know could be lifestyle, but, and you helped me. So tell everybody, what are the options you could do for the whole, what do you call this again? The periorbital area?
Periorbital, correct.
All right. So what do we got?
So, as you mentioned, one of the first signs of aging is under our eyes. And the skin under our eyes is actually the thinnest skin on the body. So, I use a lot of biostimulatory treatments. Reason being is...
Wait, pause.
Yes.
What does biostimulatory mean? I don't know that everyone knows that. Do you guys know that, what that means?
Yeah.
Well, you guys are experts. You guys are experts. The rest of us don't always know.
Okay, good point, good point. So what that means is a lot of times if you have a hollow underneath your eye, it would seem logical to put a tissue filler under there, something like Restylane or Juvederm. However...
And that's called tear trough. Tear trough fillers?
Tear trough.
Oh, tear trough. Yeah. Okay.
So if you are extremely young, I find that you can use a hyaluronic acid filler by going underneath the muscle. However, a lot of times the nature of a hyaluronic acid filler is it pulls water into the area. And if it's injected too superficially, you get it's called a Tyndall effect, which is sort of a blue hue. So I spend a lot of time when people come in with their under eyes that they've had filler. So I actually dissolve the filler, and then I typically will spin your blood down, and I use PRF, and I make a gel out of that. So a combination of easy gel with smooth threads, and threads are PDO, polydioxanolone, and they stimulate collagen. So we use really teeny fine threads with a blunt cannula under the eye to place little superficial threads along with PRF, platelet-rich fibrin. You've probably heard of PRP, which was used for many, many years in aesthetics. I switched over to PRF probably about 6 or 7 years ago. Reason being is PRF, when we process it, it's a slower spin. So we're capturing a lot more stem cells, a lot more growth factors, yielding a much nicer fill under the eye.
All right, so wait, let's go back.
Okay.
Because you are so sciencey and such an expert, I think you left most of us in the dust.
I'm sorry.
So let's talk about this. All right, a young person comes to you. What's a young person? How old are those people that you will do filler under the eyes? Because I think everyone's heard of that, right? People getting filler under the eyes. But
correct.
Who are the people that you would do that to?
A person who has a genetic hollowing, who has a lot of collagen left in their face.
So how old are they? How old are they, do you think?
20s, maybe early 30s.
All right. But after that?
After that, I pretty much love PRF, a biostimulatory. My practice has sort of evolved into, instead of using big bulky fillers all over, I like biostimulation, which are things that create your own collagen, that create your own fat.
So it's like Benjamin buttoning. You're like aging people backwards. With their own body.
With their own body, right.
Right. So that's like a whole different approach. I don't think most people know about that in aesthetics, that you don't just have to fill and be like a pillow face, right? We all saw like Courtney Cox and all these people for a long time who were just way overfilled.
I think the last 10 years we've seen a lot of people, sort of one of my, and I'm going to give this analogy. If you've had a child and your breasts are kind of totticky, saggy, lost their volume.
What does totticky mean?
Totticky means saggy.
Oh, wow. That's a nice way of saying saggy. Okay. I'll have to remember that. I'll have to remember that. We'll see someone and be like, she's kind of totticky. Her breasts, totticky. And we'll know, but other
her
people
face,
won't.
totticky.
Totticky. Yeah. Under eyes.
Yeah.
Looking a little
You're
totticky.
so totticky.
That's the word. So anyway, you'll go to one plastic surgeon and he will say, you've got totticky breasts. Let's fill that with a really large implant. And therefore, you won't have any scars on your breast. Well, if you're a tiny person or even an average person and a surgeon is recommending putting a huge implant in, if that's what you want, that's great. But if you're just looking to kind of look like you did prior to having your breast become tadicky after childbirth, I like to have that person have a breast lift. So they're going to, excise excess tissue around the breast and then put an implant in that is much more
fitting to the body shape.
Their body, right?
Yeah.
So that is sort of my theory with filling the face as well. I think a lot of people, rather than trying to tighten the face, which for many years, the only option was surgery, right? Facelift, whatnot. So now there's a lot more modalities that are available to, for instance, a thread lift can tighten the total envelope, or an energy device, something like radiofrequency microneedling, profound, closes down the envelope. Then you can put a little bits of filler strategically placed that's not going to make you look like a big pillow face.
Okay, so I feel like a lot of people, and you probably have heard this too, a lot of people think the only thing you could do under your eyes is filler. That's the only option you have. Like when your under eyes start sinking in, fill it up with, those fillers that everyone's using. But you're telling me that there are much more options.
There are many more options that are going to give you a much more natural effect, and that you're not going to come in and have to have your filler
dissolved
and starting all over again. And, that may only be, we have Cell Firm, which is radiofrequency with microneedling, that works really, really well. We have special settings just for the under eye.
So that's what did you call it? An electricity device? What did you say that was called?
That's an energy device.
An energy device.
Energy device. And so it's radio frequency, and we also use stem cells. We use plated exosomes in conjunction with that. So there's many, many modalities, and the majority of the ones that we use are biostimulatory, which are, natural, organic, that are just going to give you a much nicer look.
Okay, so from what I hear you saying, under eye filler is not where it ends. There are other options.
Many.
You like to use biostimulating, which means we're working with our body to kind of age backwards.
Correct.
Around the eye. You have a filler that you make. Can we talk about that? A filler that you make from my own blood or on any of our own blood. That's awesome. Yeah. Talk about that.
So that's called Easy Gel. And what happens is you come in, we take your blood, we take a few vials of your blood, we process that, and that means that we spin it down. And I take PRP, and that makes the gel. So I spin that down very, very fast. Then we heat that for 10 minutes, and then we cool that, and that makes the gel component.
So there's nothing else added. It's just someone's blood.
It's somebody's blood, and we spin it down and extract out the platelets. So with the PRP, which makes the gel, then we have the PRF, which we spin down at a slower spin, and then we mix those two together. So what happens then is that you have the gel, which is acting like a filler,
right,
to fill in a hollow. And then in that gel is PRF, platelet-rich fibrin. And what that does is that stimulates your own body's production of collagen.
That is wild. So you're making a filler out of people's blood. People can come to you. You can just take their blood, spin it, and no other ingredients.
No other additives.
That is wild. And then you can put it under their eyes, and it will act as a filler.
Correct. So we inject that under the eyes, and then additionally to that, to give a little oomph, we use those smooth threads. And typically it's a 2-stage process. You'll have one treatment, and then 6 weeks later, we do a second one, because it takes collagen 6 weeks to see what you've grown.
Right.
And then the combination of the 2 treatments should last you about a year.
So the Easy Gel gives you the fullness. And
correct.
at the same time, it's working with your body to create more collagen.
That's correct, because we
dope.
add the PRF to that. So for many years prior to the gel coming out, we would inject the liquid, the PRF, which is good, and it's great if you just have some crepey skin, but if you have the hollows, it takes, in my opinion, way too many treatments to have the fullness. So by adding the gel, it's a much faster process to get a fill.
All right, so I know that hollowness is a big problem, but what else do you guys hear, Kathleen, and also Jillian? What do you guys hear people complaining about under their eyes? Because I know I have a few more complaints about my under eyes. So what else do you guys hear about?
Most times more that it looks already too puffy. So you got like little pillows.
That's true. Yeah. And what about you? What do you hear?
Or just a darkness.
Darkness. All right, so Lisa, now they're throwing you some problems.
They are.
Someone comes in. Kathleen, you're going in. You have puffiness. Lisa, what can you do for her?
So we all have under our eyes 3 little fat pads. We have one laterally, one in the middle, and one medially. These little fat pads are genetic. We all have them. If you've had sushi, salt, if you've been crying, those fat pads fill with water, and then that gives you bags under your eyes. So eye bags are actually fat underneath your eyes. The treatment for that is surgery. So I have a lot of people who come in who have a complex problem. One is that they have bags under their eyes, and under the bags, they have a hollow. So the real treatment for that, a lot of injectors will try to compensate. So there's the bag, and then they try to put filler underneath it, and then you just have a bigger bag, in my opinion. And then where you put that filler, that fills up with fluid. So that just becomes a big nightmare. So I'm extremely transparent, and if you come into me and have bags under your eyes, most likely I'm going to tell you that that's a surgical treatment.
Is there anything that you can do? Like, let's say I don't want to have surgery. I'm scared. I don't want to do it. What can I do that is non-surgical? Like,
with bags?
Yeah. What can I do?
Very, very little, actually. You can, a lot of times with bags, there's also some excess skin. So you can do some laser resurfacing.
So that's the Silfirm you were talking about.
Well, Silfirm is radiofrequency.
Oh, okay.
Do you think radiofrequency helps that too?
I think radiofrequency helps with the texture and excess tissue. There's nothing that helps with the fullness of the fat pads under your eyes other than surgery.
What about Exilis? Is it called Exilis that you have? Does that help with bags?
So Exilis is radiofrequency as well, and I use Exilis on people who have what we call malar mounds. So some people present with some swelling underneath their tear troughs, and you have to be extremely careful with those people with injecting them because they have a product already with their lymphatics, and so injecting that can cause further problems. What I have found is that we do have a treatment that's called Exilis, which is radiofrequency. It's not with microneedling, it's just radiofrequency, and that frequently will improve the malar edema or, the puffiness underneath the eyes. The other thing that I wanted to mention surgically is for those patients who have fullness of bags under their eyes and then they have a hollow, the surgical treatment for that is called a blepharoplasty, where the surgeon goes through the inside of your eye, makes an incision on the inside, takes that fat and repositions it in the hollow. So
it's like another biostimulator, using your own fat this time.
Exactly. You are using your own fat. And the beauty of that is that will last you 15 to 20 years. And it's really not a significant big deal of a surgery, maybe a week to 10 days for recovery, but you will have a long-lasting treatment after that.
Is that an awake surgery or do they put you out?
Typically, you do it with like twilight anesthesia.
Okay.
So
you're
years,
kind of awake as they're poking around in your eyes, right?
Well, as far as you're concerned, you're asleep, but you just are not intubated, so it's not general anesthesia. They just put a medication in an IV, so you don't remember anything, you don't feel anything, you don't see anything. As far as you're concerned, you're asleep. But it's not general anesthesia where they put a tube down your throat and use gas. So it's, a safer procedure because it's such a quick procedure.
Interesting. So now I want to ask you two, puffiness, okay? I come to you for puffiness. What are you two going to suggest? So I'm going to start with you, Kathleen. So you better be thinking what you're going to suggest for me for puffiness. What would you suggest if I come to you and say, Kathleen, I have a lot of puffiness. Please help me.
Well, just from an esthetician standpoint, I do refer a lot of people to Lisa for the PRP under the eyes because it's just like, and I explain it kind of, like PRP for dummies. I tell them, she takes your own blood, she spins it down, all the buttery good stuff comes to the top, and then she injects it so it's very natural. You don't look like she was saying, if you put too much filler from the bottom lash, your cheekbone, your cheek comes out from here.
Right. Which
like
weird.
you're supposed to have a little bit of this. So depends on how bad it is. There are some, surface skincare products that can help that, like a temporary tightening.
Let's talk
for
about
like
it.
a special event.
Well, yeah, I'm going to the prom, obviously, because I'm only a teenager. I'm very, very young.
Yeah.
And I'm going to the prom. What do I use under my eyes? What is going to help me get rid of any puffiness? Help me for tonight. What do I do?
All right. Well, for some people, you can do some drainage and like a massage during a facial.
Like a lymphatic massage
like I
on your
don't give
face.
like a fluff facial. I give like a really, kind of hurt sometimes because of what I'm doing. I'm really cleaning or hydrating or really getting the lymphatic system going so that some of that drains. Because a lot of times if you're young, it can just happen, like Lisa said, from salt.
I feel like I need this lymphatic drainage facial.
Yeah, yep.
So I could come to you in Ridgefield, Connecticut, right? And get a lymphatic drainage facial for the prom, which I'm going to tomorrow.
Yeah. So like for a red carpet event or whatever you want to call it, or
which I also go to all the time.
Yes. you can improve somewhat depending on what you use. So this gets me into my product.
Pause.
Okay. Should I talk about
No,
this?
you should pause.
All right.
Pause. Because I want to go to Jillian's. I want you to talk about that. But first, Jillian, some of what you do crosses over with some of what Kathleen does. What do you suggest? I have puffiness in my face, around my eyes. What do I do? I'm going to the prom tonight. What do I do?
Usually, especially with women, like the ladies have already talked about, it's a overconsumption of salt, or maybe not an overconsumption of salt, but a lack of hydration.
So maybe drinking a lot of alcohol.
Yeah, definitely.
I would never do that. I would never do that.
I think most people chronically underdrink water. And
I thought you were going to say I chronically underdrink. I was going to support you quite a bit there.
yeah, no.
Cheers.
But it's really just a combination of, are you moving enough? Are you moving the right way for your body? Have you created an environment in your body that the lymph can just naturally drain and do its job the right way? And the water. It's the water.
You're pushing the water.
Drink your water.
Wow, her intervention is so not sexy.
Yeah.
I
No.
don't like her intervention. It's just
You're
drink
not.
water.
Yeah.
That's so boring. Why are you so boring, Jillian?
Listen.
We had way cooler things to
No,
talk about.
listen.
You're just gonna tell us to drink some water at
Yeah,
home?
because
Snore.
sometimes it's that simple and you just don't want to hear about it.
No, I definitely don't want to hear about that. No. How much water should we be drinking if we are concerned about puffiness in our face, especially under our eyes?
For women, baseline, you want to start with 75 milliliters a day.
Can you show me what would that look like? What would 75 milliliters
That's about
look like?
9 cups of water, like your average size cup of water.
Lisa, this is outrageous. I'm just coming to you.
That's 8.
Yeah.
Forget that. You guys, I'm getting a facial and going to Lisa. I don't want to drink 9 cups. That's a lot of water.
Yeah, it's really not. It's not a lot of water.
Is it a gallon? Like, what does that look like?
No, it's not a gallon. And then, maybe like 2 Stanleys.
All right,
So
I
you
need.
fill your Stanley cup
Do you have a
twice.
Stanley with you? I need to
don't.
see how large of.
Can you fill this? I don't know, 2.5 times. I don't know how much.
Please look at the camera. Show the camera
Can you
that
fill
giant
this?
thing.
Get
Twice.
get a beautiful cup that you like, because you're not going to drink out of a regular glass, and fill it 2.5 times in the day. And if you just start your day that way, then you're not yelling at me that you have to pee all night.
So, do you guys do that? Is that something you could drink that much water every day?
It's tough for me. I'm not a great hydrator.
Oh, I know.
But what I found is if you fill a gallon bucket every day and you carry around a cup like that and you
Yes.
pour it from your gallon, then you can keep track of how much you drink. And almost like by dinner time, you're like, oh, I need to
do
drink
better.
more, or I hit my,
Yeah.
my good hydration max.
Yeah.
Lisa, are you hitting your hydration max?
Unfortunately not.
I know. This is why
really
they have
hard.
jobs.
Yeah.
Because
Well,
I don't
I
want to
don't
hear the solution of I drink more water.
I also have a job, and I drink an adequate amount of water.
You drink? Really?
Also,
That's wild.
if you just started your day with some warm water and lemon, like you'd see massive changes in your body.
God, that sounds so hard.
I've heard that. I actually want to try that.
I've heard that.
Yeah, aesthetically, and you will just feel big changes. Yeah.
All right, so we're all going to start drinking water.
More alkaline.
Right.
Yeah. Even though you think lemons are acidic, which they are, but it actually
I would always
goes the opposite.
Advocate for lemon, and actually the combination of lemon and strawberry in your water will take down bloating quite a bit.
Strawberry?
Yeah, lemon and strawberry together.
We have some right here. Should we be doing this? Let's go.
Yes. Get your water.
Will it work
glass.
if we
we'll
put it
start
in
mashing.
Prosecco?
actually.
I think it definitely
Can I
works.
have a refill?
100%.
I need my hydration.
All right, so we dealt with the hollows, right? And I don't think, is there anything you guys could do for hollows though? What could you do for hollows? Or is that like a refer to Lisa automatically?
I mean, like I said, I have some temporary eye tightener products that I would recommend probably. And I have these really cool glass globes with handles. And they're filled with water. And you just put them in the refrigerator. So you're not putting ice pads. And they have a nice handle. And you just,
But is that's more for puffiness, no? Than for hollows, right? The deep.
I don't know. I think a lot of times, sometimes hollows can actually just look like hollows because of the shadowing.
Yeah. Sometimes when you
that's-
release that fascia that's restricted in the rest of your face, the hollow just kind of takes care of itself.
That is crazy. All right, so I don't think people have heard about that. What fascia in your face? What's that? Tell us.
I don't know. I think you could probably.
So
answer that
fascia
better.
Fascia is a connective tissue, and we're covered.
We have a studio audience, and Lisa's throwing forks at them. They're being too rowdy. Apparently, they're wild about fascia. What is a fascia? Where is it?
So we are covered in it in a huge sheet, head to toe. If you pull apart a piece of meat, like the white stringy stuff, that's the fascia.
Oh, we have white stringy stuff in our faces.
Which is made largely of water.
Okay. Weird.
But it sits on top of the muscle, on top of the organs, in between the muscle fibers, and it's actually what holds our memory and trauma. So a lot of times it's the fascia that has a restriction in it or a dysfunction, and that kind of creates like a suction cup and gets everything bound down. So sometimes
It adhedes stuff, right?
like an adhesion, yeah. So, I don't know that like a gua sha massage or something would necessarily get rid of a hollow. It wouldn't on my face because mine are genetic, but it might release some adhesions I have from clenching my jaw or, whatever else is going on
What
in
is
my
that?
body.
Gua sha. Gua sha.
Yeah.
Is gua sha something you're familiar with?
Well, it's a type of massage using a kind of like a flat marble or ceramic, probably
Tool,
like
right?
palm size usually.
Yeah.
Do you gua
It's
sha
really-
people's faces?
It's with my hands.
Okay.
It's really about bringing like the blood flow, the circulation and.
To get rid of all that fluid that's holding in there.
Yeah.
So sometimes we can have hollows because of the fluid, which relates back to the under eye bags.
Right.
Wild. So another thing I know that brings people in to see you guys, right, is wrinkles around their eyes, crepiness and wrinkles. What I want you all to be thinking right now, what could you do? What is the intervention you would suggest for crepiness and wrinkles? Lisa, I'm of course going to start with you because I know you have tools upon tools in your toolkit. What are you going to do for wrinkles and crepiness?
So wrinkles and crepiness, great question. The first thing that's going to come to my mind for wrinkles is going to be a neurotoxin. So crow's feet around the eyes, if we inject a little bit of a neurotoxin around the eye into the muscle, is going to stop you from being able to execute that movement. The other thing that we use is radiofrequency with microneedling, I had mentioned. And the last thing is laser resurfacing. So that's good for little tiny fine lines, all around the eyes. So crepiness and wrinkles would be treated with neurotoxins and some type of or a peel too, but I don't think peels are as efficacious. We really want to grow some collagen in there. So we're going to grow collagen by doing radiofrequency. We're going to stop strong muscles with a neurotoxin. And then if they're really, really deep, then we can do resurfacing.
All right, so there are a few really cool things that you do that I feel like people don't know about. So one thing that Lisa's tortured me with, done to me, is...
Lisa's always like, it doesn't hurt.
It doesn't
Don't
hurt.
worry.
Liar.
Yeah.
Lisa's a liar. She gets you great results, but she will lie to you
I
to
love
get you
that,
in that
like,
chair.
gas mask.
Oh, her, what is that called?
Pronox.
I wish I had
That's
that
right.
at home.
I know. Do you remember Little Shop of Horrors? The dentist in it is always on the gas, and he's
I
like
love
doing
that.
wild. Lisa,
I
that's
like
what she's
going
doing
to
at
the
home all
dentist for
day.
that reason.
No, so one of the things that Lisa does that I think people don't know about, which is really, really cool, is that radio frequency device you were talking about, Silfirm, literally goes directly under your eye and on top of your eye. One, it is not as painful as one would imagine, because I was terrified of that. Mm-hmm. The rest of your face hurts way more. Please zoom in on me, way more than under your eye and on your lid and brow. And they could go literally at Lisa's office right up to under your eye, which I think is cool. You don't, you're not down for a long time. No. I wasn't down for a long time. How long are you looking wild?
Day or two.
Honestly, the first time you did it to me, a day or two. The second time you added exosomes, which is part of your regenerative, age backwards Benjamin Buttons kit, and I was literally red for an hour.
Right.
And then I was back up. Mm-hmm. I think that's so cool, because I just had a CO2 pill maybe a week ago, 7 days ago, and I looked wild for days. They did go right up onto my eye right here and up here, not on the lid, but I looked wild for days. Silfirm is a little better in that you're not going to look crazy for that long, especially when you add exosomes.
Correct.
What laser do you like to use under the eyes?
Under the eyes.
That's a longer downtime.
It is a longer downtime, absolutely. So I have the Cyton, and I do the resurfacing laser with Cyton is an erbium YAG laser. CO2 is a great way to resurface, it's called ND YAG. ND YAG is a little less aggressive than CO2, old school CO2. Now there are CO2 lasers that are fractionated, so have less downtime. I love my erbium YAG because I've had it forever and it's extremely consistent.
We'll have to compare. So I just had the CO2 Cool Peel. We'll have to do this YAG and compare because I have the photos and know my downtime. I also did use the exosomes that I know you love directly after.
You did or did not?
I did. And I also, where I went for the CO2 laser suggested elastin nectar as a healing. I didn't find it to be super great, but I did use, they actually did one hand where I just used the exosome product you used, and then one hand where I used the nectar. And I didn't see a wildly big difference, except I found that immediately following, the exosomes took down the redness
quick,
really fast. But in terms of my hands healed so much faster than my face, which is so interesting. But yeah, we're gonna have to compare those two. I think that would be really, really cool. All right, now that's you.
Okay, so
I'm coming in with crepiness, fine lines and wrinkles around my eyes. What are you gonna do?
Okay, I think microneedling is a great option, very shallow.
So do you microneedle at your office?
Well, I have the scope of practice in Connecticut, there's a lot of gray areas. So they say you can't microneedle. If you're going, I don't know, at a level 2, that would be something I can't do. But if you're doing a 0.25, that's very surface microneedling.
And then
you can microneedle like serums and exomes like that.
Are you using like
stem cells?
Are you using like skin pen? When you say micro, or are you using like a rolling device? Like
no, not a rolling device. Those actually can cause scarring because you're going in at an angle, rolling it, and coming out at an angle.
Oh, that's a good tip. So don't use the rolling devices at home.
No, they sell those for women to use at home. Don't you agree?
It's
kind of like
agree.
Yeah. So what you want to do is more like a
like a stamper.
Yeah. So the needle's going straight in and out.
Okay. No,
and it's
but people do use the rolling. We'll get to hair another day, but people do use the rolling on their head.
Yeah.
And beard. Men use it on their beard. Does that leave scarring too? Just a side note.
I wouldn't be as concerned on the head because you want to just stimulate the scalp, and you're not going to, see any scarring. But on the face, I would definitely be concerned about that.
That is such a hot tip. I didn't know that. I think most people didn't know that, right? That creates scarring. So you like a stamping method, kind of like Lisa has a like glow pen that she gives to people to do at home, and you use something similar to that, or more like a skin pen.
Yeah, everything Lisa does is kind of like what I'm allowed to do, but hers is at a much higher level. Like as she says, like her stuff is like what I can do on steroids.
Okay, Well, it's also some different things. Lisa will not massage your face with a piece of jade. Yeah, she's not doing it. She'll give you a little massage after she did something horrible to you.
Well, yeah.
She'll give you a little.
She might pinch her lips here or there, right?
Little CBD oil as she tells you it'll be all right, but that's about all.
Yeah. I love that when I tell somebody, okay, I'm just going to give massage it a little bit, and they're like, can I have a robe?
And Lisa's like, oh, this is 2 seconds. This is 2 seconds. I'm in and out. I'm putting a little lotion on you, and I'm gone.
We got no time for that.
Right. Here. But one cool thing that I feel like people don't know about getting facials, and this is something I learned recently, is they're actually collagen stimulating. It's a biostimulating activity to get facials. So if you're worried about hollowing under eyes and wrinkles and fine lines, you want to go see Lisa, but you also need to see some esthetician. Like how often?
I'd say a good facial, and I'm not talking about like I say, fluff. Oh, this felt so good. I look good when I walk out the door. I'm doing a facial that's trying to change the skin. So I would say like once a month.
Once a month, wow. Okay.
And same thing with microneedling, once a month. You got to give yourself, healing time, or else it could actually be like a negative thing if you do it too often.
All right. So some people aren't ready to go see Lisa, right? They either they're pre-contemplating, they're scared of an injector, they don't want to look puffy and crazy like some celebrities that shall remain nameless, but they do want to make a change. They want to do something to make their under eyes look different. You're saying facials are a good place to start.
Right. If you have someone who's doing more than just a cleansing, an exfoliating, a mask, a steaming.
So what are you doing? I'm coming to you. I'm telling you I need some under eye rejuvenation. What are we doing?
You can actually massage the skin so much during a facial that you can do microneedling and there's no pain. It's like you don't need any numbing because you've got the blood flowing, And so if I see somebody that needs it, I would definitely recommend a medical grade peel, which I can do. I think peels are great for surface, and it also stimulates collagen because it's creating like micro injury,
right?
So then the skin is kind of like, ooh, I'm hurt. I need to,
How often can you do a peel?
Once a month again. Yeah.
Really? Oh wow, I didn't realize that.
Yeah. Oh, there's a new peel actually that is called the no peel.
I don't peel with a peel. I'm a mutant, just so you know. Nothing works on me. I might be a Teenage Mutant Ninja Turtle. I'm not sure, but literally nothing works on me. And I've tried peeling, and I don't peel.
I feel like the first peel you ever get you'll never get it again.
I've never peeled.
If you do it like one, and then 5 years later you do your next one, I don't think you're gonna peel the same.
It was my first peel. I didn't peel.
What percentage did you go with?
I don't know, but I don't want to mention the name of the company. But I did not peel.
Well, there is one that's out now that's a no peel.
I mean, I always know peel, but
And that one you can do. The protocol is to do it once every 7 to 10 days. Mm-hmm. I've seen some.
Who makes that no peel?
Bioskin.
Okay. Or do they do the bio repeal?
Yeah, that's what it's called.
Okay. Yeah, I know that's very popular on social media.
Yeah.
I've seen many, many videos of that. Yeah. I haven't tried it. It's green though, right? Is that the green one? Yeah.
And then there's a gold one that you can do on the body. I've done it on several people, and I've seen great results even after just one on some people, and then after 4, not so much. So it really depends
on the person
and how much aging they want to reverse.
What you do peels also, Lisa? What kind of peels do you like, and how much damage can you pull out of someone with a peel?
So I've done a lot of peels in my life. TCA was one of my, 40 years ago. That was the peel that I used a lot with glycolic acid. And now we do in the office, it's called a BI peel. And what it is a culmination of lots of different acids that we've used in the past. So that has TCA, trichloroacetic acid, it has phenol, it has ascorbic acid, it has glycolic acid. So I think that they're a really great concept because they take a lot of the different acids that we've all used independently of one another and they put them together. So you're getting the best of all the peels. And it's something that's done in the office. We cleanse your skin, we apply it, and typically you'll start peeling in 1 to 2 days and you'll peel for 5 to 7 days. But I want to mention something about that. Why some people peel with a peel and why some people don't peel with a peel. And the answer to that is depending upon what you're using in your home care.
Good point.
Right?
Yeah.
Mm-hmm. So your skin can only peel if there's skin to peel. Okay. When we're using things like retinols, so retinols increase our
Cell turnover, yeah.
Our cell turnover. So it allows skin cells to come to the surface to peel off. So if you've been using a retinol for 10 years, the chances of yes, please.
I did drink. I did the international symbol of drink.
Hydration over here.
I'm going to throw a fork in a minute.
Best part of the podcast.
Right?
You throwing the fork. I just want this part. But I bet Lisa actually has a very complicated drink order.
I do, but I love the strawberry for hydration.
Best tip. Hot tip.
I'll have a little bit.
Stick a strawberry in your champagne.
Strawberry and lemon
during brunch.
In your
Done.
Water or prosecco.
Yeah.
Healthy.
It's
and they
almost
work
clear.
the same way, right?
Wellness expert
There's
certified.
No dehydration in alcohol.
Wellness expert certified. Yeah, so I think part of why I didn't peel was you recommended the exosome-based skincare to me, and I was using it constantly on the reg, and I think that's why I did not peel.
Thanks, honey.
So you're probably peeling every day,
right? And that's what
without
I'm saying.
seeing it.
So if you're using exosomes, if you're using retinoic acids, if you're doing facials, a lot of these things are exfoliative in nature.
Right.
So, and it gets frustrating when, you may have come to me and had a peel, and then, a year later you come and you peeled like crazy, and then a year later you come to me and you have another peel and you don't peel. My peel didn't work. Well, it's not that your peel didn't work. It's that your skin peels all the time, and you may be at a different part in your skin exfoliation process, or because of other products that you're using, it's going to negate you peeling significantly.
Who knew? Who knew, you two experts?
Yeah.
Who knew? Lisa, can I have you pull your microphone closer to your mouth?
You can.
Jillian likes to talk back. Like Jillian's like here and is like, I'm going to talk about something very complicated, far away. All right. So another thing I really, really want to talk about is I know Lisa came in one day with the banging eyebrows. Lisa, do you remember that day that I saw you with your gorgeous eyebrows? I want to talk about not only can we do things where we could surgically or non-surgically intervene, we can also just do aesthetic things that change the look of our eyebrow. Definitely. And our eyebrow, of our eyes, right? That brighten them up, make them look younger. that is your area of specialty. First of all, I'm looking at you and I'm dying and I want your eyelashes. How can I get those big bright eyes?
Okay, so you can literally create the look of a brow lift by having great brows.
Tell us how. We're here for it. Let's go.
Well, I think youthful brows are full brows. If you think about it, as you age, you lose brow hair, or if you're sick, you lose brow hair. So when I do microblading, which is using the tiniest little blade, you can't even see it from the side. It's so tiny. I dip it into a pigment that matches your hair color, and I just draw in like hair-like strokes to give you the shape that you want, or shape that you need, actually, for your skin, or for your bone structure. And the width, like the thickness of the brow is up to the client. The arch, how high or low or how dramatic. What do you
recommend to look younger? So let's say Jillian comes in. Jillian, do you have eyebrows? That's what we want to talk about today.
Not
do
really.
you have eyebrows?
No.
All right, so Jillian comes in. She has no eyebrows. What are you going to do to give her the most youthful eye? Boom.
Well, you know what? She probably has more hair than we can even see. So at first, if I were to look at her under the light, I might suggest just a tint and a shaping, because the tint will pick up all these little baby fine hairs that you didn't see. And you can't even see some of them in even dark haired girls, women. So we might try that. Or if you really need the microblading, that would be like the best.
Is microblading tattooing? I'm confused about what microblading is. And I mean this in a genuine way, because my eyebrows are black and my hair's blonde. So I don't know, but I want to know, what is microblading? Can you define it for us?
It is considered tattooing.
Okay.
A lot of people are doing it without a tattoo license.
Do you have a tattoo license?
Yes. So whenever, and you're required to in Connecticut.
Can you give me a tattoo?
Yes, I can give you a tattoo, but I don't do tattoos. Okay, so microblading is semi-permanent because of the depth that you're going in. So it will eventually fade. Maybe not 100%, but it definitely fades. It's going to last anywhere from like 8 to 18 months. Sometimes you'll get 2 years out of it.
That must be so stressful, tattooing someone's face.
It is. And I
think I would literally, I would have to have many glasses of this to feel confident.
I've been doing it for like 7 years, and I still get anxiety because you're carving into someone's face.
Yeah.
So a lot of girls go for like a 3-day training, and then they start, like I said,
tattooing
carving into somebody's face. A lot of women go to like a Groupon, and they come in
looking
and ask
wild.
me if I can help them. And no, I can't, because the depth is wrong, the color's wrong, the person may have gone too deep, and that eyebrow is never going to go away. So it is, anytime you put pigment into the skin, it's considered a tattoo.
So number one, I love that you dealt with the Groupon thing, because I am a scrimper. It's true. I really am. But I want to go to good people.
Okay.
I know I do. Listen, this is my friend here. I clearly am not scrimping that much. Right. But Lisa has told me so many stories of people who come in who've gone to Groupon people.
Yeah.
And then she has to try to reverse what they did.
Yeah.
You're seeing the same thing with you, right?
Yeah, I tell people, like, save money on your cell phone bill, not your face.
That is a catchphrase.
Yeah, really. Like, you're
but
wearing this on your face. And a lot of times I won't touch people for like a fixer, because I don't want their eyebrow out there and them telling people that I did that.
Ooh, I need you to look in the camera and say, save money on your cell phone bill.
Save money on Verizon.
Not your face.
Yeah, not your face.
Ever. That is such a good point, because you literally have to carry that around every day. And the same thing goes for you too. Like, how many people come into you who tried to save money, they come in looking wild, like I can't even, I don't even want to say how they look. Not good. And they need you to fix it.
That's correct. And I'm going into my 40th year of what I'm doing. So fortunately, I don't have to use Groupon, and I completely, wholeheartedly agree with Kathleen's analogy to that, in that it's great. We all like to save money, clearly. But when you're dealing with doing something to someone's face that's, even if it's going to last 6 months, 9 months, you're going to want to go to somebody who really pays money. I spend tens of thousands of dollars a year to keep training. There are many people in both of our professions that, take the 3-day course or whatnot and are still doing things that were done 10, 15 years ago. The rate at which aesthetics is growing
it's wild.
It's amazing. I'm 61 years old. I am so sad that I only have about, 9 or 10 years left in this field, because I feel like I'm just on the tip of the iceberg.
I don't think so. You're regenerating. You're Benjamin Buttoning. You're going to be 30 next year.
I understand that, but it's just such an exciting field, and you just, in my opinion, you don't want to go to somebody who uses Groupon for anything in their face. I've used Groupon, for a dinner, for a car wash, for a waxing. Mm-hmm. Listen, I want to save money as much as anyone else does. Waxing of my car, not of my body.
That phrase, I feel like that's going to be your catchphrase forever. Save money on your cell phone bill.
I tell everybody that too. And when I give them my price, maybe it sounds high, but
so
it's only high until you get screwed up by somebody that charges $200.
Right. So, okay, all right, given that information, right, not everybody's local to us in Connecticut, and they may be seeing this. Mm-hmm. How do they, besides going to you guys, obviously, how do they pick someone that is a well-trained, well-seasoned professional that's not just going to wreck their faces? How do they pick that person? What do they do?
They should be going on Instagram, because, we all market ourselves that way. And they should be looking at before and afters with pimples and pores and redness and freckles. So I never touch up my microblading. You will see.
That is such a good point. So you want to see imperfections in the afters, because if you're seeing perfect skin.
I want them to see, this lady has pimples, or this lady's red. The redness is actually caused by waxing, not even the microblading. But, you can give yourself a 19-inch waist these days with any kind of app.
Oh, I thought you were going to say you can give me a 19-inch waist right now. I was ready to sign up. Was it that massage in the water? Yeah. That's what. Okay.
So I want people to know this is real, and this is how you'll walk out. Okay, and then I also, in my pictures, you see that no matter what hair color the person is, and when they in the after shot, they look a little bit more auburn than when they came in, and that's because every single person cools as a heel.
That is such a good point. And I know Lisa is very serious about no one touching up her afters. Mm-hmm. So sometimes I will look at her afters and go, Lisa, this person looks wildly red. Mm-hmm. We can't show that on Instagram.
Yeah.
And Lisa's very insistent that we leave people just the way they are, so people know that they're authentic before and afters.
Absolutely.
That is a very good point. And I think that's another really great tip that people don't know about. Mm-hmm. To look for these before and afters, to not look for perfection, look for those pimples, the redness.
Yes, exactly.
To know that that's an authentic picture that hasn't been whitewashed.
Mm-hmm. Exactly.
I do with all of my pictures.
Mm-hmm. Yeah.
Okay. So I also want to talk about, and I know we haven't even touched upon this, but I really, really want to talk about Kylie Jenner. I know you all saw her. She was at an award show. She had a lot of swelling under here. Have you seen the picture?
No, I refuse to watch.
I have some good news for you. I have it right here. So what was it? Is that? Also, have you guys seen yet the new Jake Gyllenhaal movie? What is that? A Roadhouse? Mm-mm. I was watching it, and you guys, I want to click on his look at under Jake Gyllenhaal's eyes. What is going on? He's such a cutie. What would each of you suggest for him?
I really think guys can get away with that.
Isn't that some bullshit?
Yeah, it is.
That is some.
And they can also get away with a little bit belly.
Oh, girl, don't get me started.
Don't you think?
Lisa's husband just lost 300 pounds thinking about giving up soda. Meanwhile, I'll eat a grape and I'll gain a pound. So I'm not really with that. But
let me see that little picture.
You want to look at my new husband, Jake Gyllenhaal?
I wouldn't mind that if my husband looked like that.
You know.
I hope your husband's not listening. What do you think? Jake Gyllenhaal.
I actually like it. I think he's got that kind of rugged, manly look.
Yeah, you know what? We need manly
We
men.
need manly men.
Definitely.
You know what? This is some bullshit. If that was a woman, we would be saying she needs under eye threads. Let's give him some threads.
I know, but we're all women and we like this. We like,
you know what,
he's
that's-
rugged. He's
it's
like
so-
tough.
it's
He's
so
like a real man.
Girly,
you know?
girly pop. It is so true because I have to say, when I look at men who have like squinchies right here, I'm like, hello. But on women, I'm like, really? She should.
Yeah.
She should definitely do something about that. Does she? Here's Lisa's card.
Yeah.
No, I totally agree. And, you know, my husband, I love my husband to tears, and I've known him since 2010, and I've not done one aesthetic thing on him ever. The only thing that he did was that he did tirzepatide for weight loss, and he lost 30 pounds this year. And
Yeah, with your company, right? With SveleteSolutions.
And he looks amazing. But
He does. He literally.
I am not saying that I don't treat men. Of course I do. Probably 15% of my populace.
Are you just saying they need it less?
I think
Because
They
we're
want it.
more
They
women are
desire it
more
less.
accepting. But you know what? I wonder if it in the gay community, I don't think that's true.
Oh, well,
Because in the gay community, they're being judged by other men and they're getting the same bullshit we get, right?
well,
so
gay men are like women.
yeah.
In terms of their aesthetic. I mean, that whole metrosexual look.
They
and,
want to
you know,
get
Yes.
they want to get
They
fixed
want to
up.
get everything. Can I have a little orange juice? No.
This is our waitress, Sarah. Can you pass me the iPad? I want to show you pictures of some other celebrities because we
can I
looked at
see
Jake Gyllenhaal and we
Yeah,
said
yeah, I know, I'm good.
that he's doing our. If this was a woman, I think we would do so many things to his
Well,
eyes.
of course. Can
What
I
do
have
you
some,
think?
Saint Germain. Thanks.
Well, you can see like how yellow his under eyes are getting. So a lot of times with the creepiness under the eyes, and this is of course true for women too, it's a hormonal imbalance. So he's probably producing too much cortisol, and cortisol is also produced.
And that's
by
the stress hormone, right?
Yes, that's your stress hormone, but it's also created by eustress, good stress. So working out.
Oh, and he's cut in
Preparing
this
for a
movie. I don't know
wedding, like,
if
yeah.
you guys saw it. You should go home and watch it.
Yeah.
But he is very cut in this movie.
Yeah, so I would venture to guess that in preparation for that, if you work out long at a certain intensity for longer than 45 minutes, your body starts to produce
the
cortisol.
Yeah.
Also, the cells in the top layer of your skin under your eyes produce cortisol if you're going through any kind of stress, good stress or bad stress. And I think that's something that's overlooked. And I think
That's another
Yeah.
hot tip, girl. Hot
Yeah.
tip.
Good.
I didn't
Stress
realize
is
that.
stress.
I thought if I was jogging, I was immediately going to look thin and
Yeah,
perfect.
no.
Oh,
Mm-mm.
okay.
No.
Weird. I thought that's how it
Yeah.
happened.
I would also guess his liver's not really doing its job.
Maybe he's having too much. What did you just order, Lisa?
Prosecco.
A little Prosecco and Saint Germain, perhaps?
All right. So
But I
now
have my strawberry in.
it's in. So we're good. Is there lemon? Is there lemon in there?
She has a lime.
Okay. Very close. Very close.
Yeah.
All right.
Also,
now-
family.
speaking of cortisol,
yes. Let's speak about
I
it.
gave up coffee and my stomach has never been so flat.
Yeah. Yes.
Because
Really?
coffee produces cortisol.
Don't
Yeah.
say this to me.
Yep.
That's like my last thing that I love is coffee.
Yeah, I always felt a little bloated.
What do you
Whether
think
I
about
ate-
coffee is bloating you?
It raises your cortisol.
It's yeah. Yeah. So a lot. because
So
we're
you're telling
all-
me my stomach is not going to be flat and nor my under eyes if I'm stressed?
Look, the reality is like we're all in an adrenal crisis right now.
I'm
Like,
in
just
it
with
right
the way
now.
life
You just
is,
gave me
yeah.
this crisis.
Yeah.
And all of this starts in your gut.
Oh,
So if you're not,
she's back on this water
yeah.
thing again.
No. Yes. Drink your freaking water. But if you're not creating the proper microbiome in your stomach, nothing's going to do its job. None of your hormones are going to function the way they should. That's going to affect every other thing that your body produces.
So my under eyes are going to look yellow,
Yeah.
wrinkly, poofy, and my stomach won't be flat.
Yeah, so at the very
She's
least,
ruining my life.
start with a pre and probiotic at the very least.
Yes,
All right.
yeah.
So for my eyes, I have to be taking probiotics.
Probiotics, your fat soluble vitamins, your B vitamins, zinc,
All right.
magnesium.
Hit us with it. What supplement should we take to help with our under eyes? This is wild. I just wanted to, maybe do a little gua sha,
Gua sha.
gua sha,
Right.
Hi chow. So I wanted to do a little bit of that, and I thought everything was going to be fixed, but now you're ruining my life. Tell me, what else do I have to do?
In the beginning of my career, I was like very anti-supplement and like, people should just be getting what they need from their food. But the reality is our food is not nutrient dense anymore. So of course, please consult a doctor before you begin any supplementation because I am not a licensed physician.
So we should sue her. Is what
But for all the things we've talked about, including our adrenal systems, you want to make sure that your fat-soluble vitamins, so A, D, E, and K, are at an appropriate level. You want to make sure that your B vitamins are at an appropriate level or you're not going to metabolize any of your other vitamins. Zinc and magnesium.
Zinc makes your Botox last longer.
Yeah, zinc's
Let's
big.
talk about that.
Zinc's
if you
big
get your
for-
under eyes zhuzhed by little Miss Lady over there, take some zinc, right?
Yes. Because zinc's going to help with your immune response. And the harsh reality is that a lot of what's happening is an allergic response to food, environment, stress. Like you're introducing something into your lifestyle, internally or externally, that your body is like revolting against.
All right, so give me. You're saying too many things, and my brain it's bogged down.
Too much bandwidth.
All
You
I
have the
know
bandwidth
is
for that.
guacha, and injections. That's all I heard so far. So what brand am I going to Whole Foods and buying? Am I buying it at Whole Foods? Do I have to order it online? What am I getting?
You should research any brand that you are going to use. Make sure that it's a bioavailable brand and that it's produced.
Okay, so what do you like, girl?
Well, okay, so for pre and probiotic, I like a symbiotic because they work together. A probiotic alone is not really enough. So I use the brand called, oh my God, because you're asking me, I'm blanking.
Do you know the brand
Seed.
you use?
It's called Seed.
Yo, I just ordered
Yeah.
Seed.
I
am so excited about Seed. I just ordered Seed.
I started using Seed and I've used because I'm in this profession, I've really put my body through it to test and all of these things. I started using Seed last spring and it's unreal, the changes in my body.
So I'm using Seed. I just ordered it. I think we should all order it and do a little test here. And I also started using, there's some, it's a maybe some of our audience can search this. There is a probiotic strain, starts with an A, acacia. Dave Asprey talks about it. It's a very specific strain that ages you in reverse and makes you skinny.
I want that.
Can our audience search that for me? It starts with an A. It's a probiotic strain. Acacia.
Okay, on it.
Dave Asprey talks about it. Anyways, I just started that too, so I'm very excited about that. All right, so Seed. What other multivitamin or something? We need simple takeaways.
You just get a simple B complex.
What brand do you like?
Honestly,
Because there's so many brands.
There's
We don't
so
know.
many brands, and I really like the Ritual vitamins. They're
Clean, right?
They're very clean. Yeah, you're not getting a lot of additives.
And where do you get those?
Soy-free. You can get them online.
Online or what store?
Online.
Just online. Okay.
I think
Does Amazon have them?
I'm not sure.
Because I will love to link in the bio to that, right?
Probably. I don't think you can get Ritual in the store, but everything from their vitamin C to their prenatal, everything is sourced. Clean. It's clean. There's not any additives, gluten-free,
And you also like them, Lisa. You like them too, this Ritual brand?
I've heard of Ritual. I don't use them, but
yeah.
But you're going to start after this recommendation from this expert. What about you? What vitamins do you like to suggest to people?
I do Floricor. It's a pro
Floricor, yeah, I've heard of them.
Or maybe a combination. But Lactobacillus casei is amazing for stomach fat.
We're learning so much. And I actually think we're almost out of time. And I don't want to do that because we haven't even talked about eyelashes. I think we're going to have to do this again because we haven't even talked more. What is it called?
Was it ashwanda?
No, it starts with an A.
Yeah, ashwanda.
No, ashwagandha is not.
It's ashwagandha,
And that's not. It's not a probiotic. It starts with a.
But you should all be taking it anyway.
Yes.
What is it?
It's good.
It's amazing for a variety of things, but especially anxiety, depression, sleep, regulating
I just want to
those
say
systems.
something. Kathleen did my brows, And they're fabulous.
They're fabulous. And we have so much more I wanted to talk about with Kathleen, so she's going to have to do this with us again.
Kathleen is a huge asset to a lot of us. She has done my daughter's brow shaping. My daughter
which
is
killed
African, and she killed it.
Yeah. And you should be doing my eyelashes, Jillian, do Jillian's
You need
eyebrows.
your eyebrows done.
No,
You know what? Stop it.
One of the biggest mistakes women make when they're doing their eyebrows.
Tell
though,
me, what is it?
There's certain points to the eyebrows.
Oh, can you show it on me?
Okay, sure.
Yeah, let's do it.
So there's this top point. So from the top point to the upper arch is basically a straight line, which you have. Great. This upper arch should be the highest point, and it should be about like 2/3 to 1/3 to the tail.
Okay.
Okay, so you have a good proportion there. And then from this point under is also kind of a straight line, and you have that on this side, but this side is a little bit more of like a golf club.
Yeah.
So you've got like a bulb here and then the handle of the golf club.
I can't wait for you to do her eyes.
Yeah, you would want to create like a straight line from this point to the under arch. And then the most important thing is from this point to the tail should either line up with that point,
Which she kind of does.
or be higher. So a lot of women, they do this, they've seen this on TikTok. So they bring their tail all the way down here, which gives you like the sad puppy dog look. Yeah. And that makes this part the highest. This is lower. This part needs to be the highest, and the tail has to be either
So we're
lined
going to
up
do
or
it before
higher.
and after, Catherine. That's what I've heard.
We're
doing it before and after.
She's amazing.
I'm ready.
She's amazing.
I really wish we had time to talk
you
more
might
about
even
lashes.
qualify too for just like a mini microblading. I offer that to people that have pretty good brows, which you do have.
She has pretty good brows,
yeah.
but I think she needs a little more.
I can just throw in a few strokes to make them, perfect.
I love a few strokes. Okay, so I'm with it. But before we end, and I know I see Doomer, our audio visual guy, giving me the director's cut look. But before we end, I do want to talk about products that you love, each of you. I have ones I love and that I want to talk about, and then we have to wrap up. Even though I think we can go on, and we may have to do a part 2 on eyes because we didn't hit not even half the things I wanted to talk about. But Lisa, your like must-haves, I know they're going to be like ones we can't buy in a store that we need to come see people like you for, but what are the things you absolutely love? Give me your top 3 and give them fast before the director cuts me.
Pavis, sunblock, fabulous. I'm going to take one of yours. Plated exosomes and Upneek, which is our little eye brightening drop.
Eye opener, right? Like I've heard a lot of really good things about that. I have little tiny Peabody eyes, and I'm always trying to make them look larger. So ready, you go, Kathleen.
All right, I promise myself every day or whatever to never buy another product because my bathroom and my vanities in my closet are full of product. So the other day I was cleaning out my products and I found this full bottle. And I looked at it, Eye Solution, non-surgical lifting innovation, Grace Perfect Skin. And I was like, I'm going to try this. I tried it, I loved it, and I looked it up. And it was $1,900 for this. There's no way I paid that. So I don't know what like the eye fair.
Can you hold that up to the camera? This is what $1,900 skincare looks like.
I don't know how I got
You better
this
give me
in
some before we leave.
There's no way I paid that. So like I don't know if like the
providers
fairy
they get the inside scoop before the rest of us,
but this was ridiculous. I don't know anybody that would spend that. So then I found a dupe. This is $40. Okay,
I love a
this.
dupe. I love a dupe.
This is Peter Thomas Roth Instant Firm Eye Temporary Eye Tightener, which these are temporary, but for an event or even every
for
day.
my prom that I'm going to.
You can actually feel it like tightening. It's like putting egg yolk on your
so
face.
wait,
or
tell me
something.
the dupe's name again. So this is 1900. This is 40.
Yeah, and like I said, I never bought this. I don't know how it ended up in my repertoire. Okay, so Peter Thomas Roth. This is Instant Firm Temporary Eye Tightener.
Ooh, we're all buying that. We're all buying that. Shouldn't we get a PR goodie bag from this? Send us, please, some of this.
Well,
We'd love
maybe
to
I'll
try.
get a sponsorship from
Yes,
this.
absolutely.
So then I can afford it, right?
We'll all be
This is
using
so
it.
good.
Ooh, she made me feel that. I felt it.
And then this is Grande Lash.
Oh, I use that.
Oh, you do? Yeah.
I do.
I use that too.
I
Oh,
love this
I'm so
one.
glad you said that because I use that and I've been very worried. I heard that some eyelash serums could reduce the fat pads under your eyes and change your eye color. And Lord knows I'm trying to stay young forever. So
Yeah.
I did not want that to happen.
Yeah, this one doesn't change your eye color.
Does it do the fat pad reducing? Because I don't want that.
I haven't taken notice of that, but
Yeah,
what
I
I
didn't
do
either.
with this is it's clear and it's super fine. And I just like close my eye, swipe it across my upper lid, go use it at night. It migrates into the lower lashes and makes them
And you
grow
have light
crazy
eyes.
too.
It hasn't changed your eye color.
No, not at
I
all.
worry about that because I love my eye color. They're a little
Yeah.
tie-dyed. I'm
Yeah.
kind of with it. So
And
I
then
just don't want it
also
to
do
change.
this too. Instead of buying they have a brow serum also.
Yeah.
I just put this in my brow.
You do it on
too.
your brows too.
Yeah.
Okay.
It's the same,
Those were super dope recommendations, and I love the dupe. I love that. All right, Jillian, your turn. And then I go because I have some really good ones.
I'm sure you do.
I do. I definitely do.
I love the Pivy sunblock that Lisa already talked about.
So do you apply that periorbitally or?
Fight all over.
Yeah,
Oh,
everywhere.
okay.
It
All
goes everywhere. It also acts as like a really nice primer under your makeup.
Hot tip.
Yeah.
Okay.
It's like a
okay.
filter.
Yes.
Ooh, like a filter.
Yeah,
Okay,
it's really
I want
nice.
that filter life. Okay, go ahead.
Water. Please drink your water.
Back to the
That's
water.
her product.
God,
Strawberry
That's like
and
my.
lemon.
I probably say that 100 times a day. Please drink your freaking water.
Yeah.
oh, I hate that. That sounds
It's
like a lot
so
of work.
important.
Yeah. And my under eyes are incredibly dry, so I am addicted to coconut oil. I have to use coconut oil every single night. When I don't use it, I see a huge difference. So I use that for everything.
There you go.
All right, so coconut oil. All right, wait, give me 1 second because I hid mine. Can you actually grab that for me, Jillian? I hid my products under the table because I didn't have any space with my my little brunch situation. All right, so the first thing that I really, really love, ready for my commercial moment, is Plated. Plated Exosome Skincare. It's my favorite. I like to apply this one, based on Lisa's advice, around my entire eye. I think it's so great. I love it. Intense is my favorite. Some people really like daily. I think you really like daily, right? I
prefer intense.
Yeah, I prefer intense. And here's why. Not only because I'm intense, I want something called intense, but I also like it because I think it goes on smoother.
Yes.
I don't like the thickness.
I like the thick.
Listen, I like them thick. We talked about that earlier, but I like my skincare a little thinner. So I like that this applies very smoothly under the eye. But another thing that I've recently started using, I have it in a little bag under here. And I don't know if you guys use Color Science. I think Lisa might be the first person to tell me about Color Science. Color Science under eye. Okay, this stuff is dope. Number one, it's sunscreen. It's not even makeup. It's actually sunscreen. And it has this like nice little metal. I actually use this, so it's like nice and dirty. This awesome applicator that is cooling. So like if I feel puffy, I love it. I think this brand is so great. Although they have a powder that is very weird. Fix your applicator, Color Science. I'm not loving it. But this applicator, I love. And I think this is so cool because it's also SPF and it has like ingredients that help with like puffiness and brightening. So I love this. I love
Do you get
Color
that? Can you get that, online or
I do.
shopping?
Yes. See our Amazon link in the bio. No, you can buy it on Amazon. I bought this at a Medi Spa in Arizona when I was there for work. I love it. I think it's great. I would definitely recommend it. Another thing that I happen to know about because I work with this company, in all honesty, not Color Science, but Plated, is that they're coming out with an eye serum. This is the first time anyone here has seen it. Okay. I know. It is brandy new, hot off the presses. This one's actually empty because this product is so sought after. I could not get a sample.
A plated eye serum?
A Plated eye serum.
Shut the front door.
Shut the front door. So this is an exosome enriched eye serum that also has added botanicals for brightening, smoothing.
Come on.
Now I know. We're all about it. It's going to make your eyes
When
look
did you
so
get
dope.
that?
It is coming in June. You guys are the first to know.
Wow.
Is that only available like through medical spas or?
So estheticians can also carry plated. Plated is only available though through professional offices. So Lisa carries plated. Estheticians can carry plated. Plastic
Yeah.
surgeons,
Definitely.
dermatologists.
I need a new line.
Oh,
should
this
carry
is
plated.
it's so. This is exosome, so it's working with your body to like renew the appearance of your skin, your under eyes. We have a hair serum. This is really cool. But this is one of my favorite things, and let me show you what I really, really like about it. Ready? Boom! That same applicator that Color Science has, and we have the little pump here. It is empty because this is so brandy new, but I'm super excited about this. I've been testing it for a little bit. No pun intended, have been testing it for a little bit. And
Eyes in March. Wow. I'm
yeah.
excited. This is great.
This is great. And of course, Lisa will probably be one of our first offices to have it since she knows somebody. So if you would like plated eye, you should definitely call Lisa's office. What's the number, Lisa?
831-8029 with a 203 in front of it.
203. And Lisa will have this probably before anyone else. And I love the regular intense, honestly, around my eye also, because I think it does all the amazing things without the added botanicals. But I also want to protect, because what is like your first skin tip for everyone? Protect from sun, right? So protecting from sun with a little color correction and brightening. Can't get enough of it. We have to do this again.
Yes.
I didn't hear not even half of the things I wanted to talk about with you two. I talk to Lisa all the time. She's kind of my bestie for the restie. So we talk about these things all the time. But I would really, really love you guys to come back and talk about, like, I want to talk about eyelashes. I want to talk about massaging my face and torturing myself with water more. Water torture.
Waterboarding.
Waterboarding. So we're going to get back to drinking and eating. Thank you so much for joining us. Follow us for more content because we are killing it out here in the beauty mafia of Connecticut.
We sure are.
Let's give our Instagram.
Oh, yes,
Okay.
please. So smart. So smart.
Yeah.
Lisa, what's your Instagram?
My Instagram is Split Rock Aesthetic.
Yes, at Split Rock,
At
Split
Split
Rock
Rock
Aesthetic.
Mine's Get Glowing Tan, and you can see a ton of before and afters of brows.
Oh, and we wanted to talk about tanning. We're going to have to do so many more of these. And yours?
Yeah, we are SveleteSolutions LLC.
And your private?
And my private is at Collective Energies Fitness.
Yeah, and she's looking for a husband, so no, just kidding, just kidding, just kidding. Don't. Just kidding, just kidding. Thank you so much. We had so much fun.
That was great.
Follow us. Thanks.
You.